So hi guys, in this video I'll be telling you about malaria. I'll be telling you all you need to know in the aspect of symptoms of malaria, prevention, diagnosis, and the treatment of malaria. So stay tuned. So what is malaria? We already know about mosquitoes. Mosquitoes, when we are bitten by mosquitoes, they secrete some salivas into our bloodstream and it causes some infection, causing us to have the symptoms of malaria. So what are the symptoms of malaria? We have symptoms like fever. I always say this: whenever we are having illness, the first sign is fever. Fever is in a response, it's just like an alarm clock telling your antibodies, wake up, there's something happening. So we have to start fighting. So fever number one, cheese number two. We have general feeling of discomfort. Headache is coming to play a role in the symptoms. We have nausea and vomiting. We have diarrhea. We have abdominal pain. We have muscles of joint pain. We have fatigue. We have rapid breathing, we have rapid heart rate and cough, etc. So these are the symptoms of malaria. So how does the symptoms play? Like fever, we know whenever we're having any issues which is leading to anything that we arise, we require the antibodies to come and work. The fever will start playing roles, we feel somehow cold, and our heart rate is going high, something like that. They just work hand in hand, and most times all these symptoms appears in other differential diagnosis. When I'm talking about differential diagnosis, I mean in other cases, in other medical conditions. All right, so now coming to the diagnosis of malaria, we have to diagnose malaria in we can do some blood tests, all right, to know if the person is having malaria or not. But guys, I don't like skipping diagnosis because it's so important. All right, to diagnose malaria, your doctor will likely review your medical history and your recent travel, conduct a physical exam, and other blood tests. Blood tests can indicate if you have malaria or not. Don't skip diagnosis, because if you're not having malaria, then you're just suspecting on your own that you're having malaria, because like I just said, most of the cases are similar. You're having similar differential diagnosis with, like, let's say for example, fever is playing a role in malaria. Fever is also playing a role in osteoarthritis. Fever is also playing a role in osteomyelitis. Fever is also playing a role in COVID-19, of HIV. It's just similar. You don't know which one is playing, which one is this. Headache is playing a role in COVID-19. All right, so you don't know which is this. So blood test is very important to be done so that you know if you have malaria or if you don't have malaria. So now, what are the treatments which you can prescribe to somebody who is having malaria? Your doctor can prescribe you some medications. I'll just call some few, all right. But apart from that, you should do exercise, which I will be talking about. All right. So it depends on your age, and I will recommend you can know the name if you wish to know the medications. But if you don't have any experience or any knowledge, please refer to a professional doctor, not a professional doctor from YouTube, so that you know what I mean, so that you get nice care, nice treatment. Don't just watch from internet and go administer on yourself. Apart from you're trying to learn and gain the knowledge like students, then that is fine. All right, so what are the medications which I will just tell you to? We have chloroquine phosphates. Chloroquine is preferred treatment for any parasite that is sensitive to the drugs. All right, but in many parts of the world, parasites are resistant to chloroquine, and the drugs is no longer an effective treatment. So, but chloroquine will help you in relieving malaria. All right. So, guys, after you've gotten the prescription of medicine from doctor, if you get the chloroquine and you have dissolved your malaria from your body, then next I will advise you to get into physical work, because you have to boost that immune system, right? And I heard exercise help in boosting our immune system. All right, so what are exercise you can do? It depends on how much you want to last. I would say your exercise should be divided into a fit principle. We have F for frequency, Your frequency should just be like 5 times a week, moderate 3 to 5 times a week. If you're busy 3 times a week, all right. Then your intensity, you should just give a moderate intensity, all right, so that it will not be so stressful. Or let's say example of jogging is fine, all right. Don't go too much, moderate. And your time, you can just do time of 30 minutes a day. If that is too much, you can reduce it according to what is fine with you. I would say you should start with 5 minutes a day jogging. So that's just it for prescribing the exercise, the type of exercise jogging, right? So thank you for watching, guys, and have a very nice day.